So let's talk about the most common types of low back pain and kind of what the implications of each of those are. So there's three main types. There's obviously lots of different subtypes of that, but there is kind of disc-related low back pain, so where we have bulging or protruded or ruptured, or there's a lot of names for that, and those are all just meaning that the disc material has kind of bulged out into where the nerves are. And so there's varying degrees of how bulged out into those nerves it is and whether or not that's causing problems. The second type then is more of degenerative changes. And that word degenerative sounds scary. Really all that means is that we're getting wrinkles on the inside. Like we're getting older, and so things tend to just change over time. And so some of those degenerative changes are some arthritis formation at times, or the disc height itself can narrow, so the discs aren't quite as spongy and full, and so they shrink down, or the vertebral bodies themselves, so the bones of our back can start to shrink over time as well a little bit as we age. And so, you know, those things are just natural parts of aging and don't necessarily mean that there's a problem. There's also then kind of muscle strains and sprains in the low back. So those three are kind of the most common, and each of those kind of corresponds with different ages and stages of life. We tend to see the muscle strain and sprain and the disc bulges being more of a factor at younger ages, and at older stages of life we see more of the degenerative changes, or the arthritis and other forms of the wrinkles on the inside. We can get disc bulges at any age, and truth be told, everybody has all of these things actually at certain points in their life. So of 30-year-olds walking around with no back pain at all, a high percentage of them actually, so I think it's around 30% of 30-year-olds with no back pain have one or more disc bulges. At 50 years old, I think it's 60%, and at 80 years old, I think it's just about everybody. And so those types of things are just a normal part of living, that we get disc bulges, or we get some degenerative changes, or we strain or sprain muscles. All of that, you'll see your MRI results and they seem really scary. Honestly, all of that is really pretty inconsequential. As long as we get back to moving, we strengthen things up, and we don't try to rest things away to where it actually gets weaker and causes that problem to become worse, we can get rid of the symptoms of pain and get back to living a normal, healthy, active lifestyle. And so don't rest away the pain. Instead, find out exactly what you need to do to move and get rid of it. So we're going to walk you through what to do with different types of pain so that you can get back to moving and get back to your life.